Assalamualaikum warahmatullahi wabarakatuh. My name is Nurul Azam binti Abdul Aziz, metric number 1170265, and today I will share with you about the radiation protection and safety. The use of radiation in medicine should be justified and optimized as recommended. In addition, International Commission on Radiological Protection (ICRP) has worked for several decades to develop the radiation protection philosophy based on a broad scientific basis and formulated some fundamental principles given by the keywords justification, optimization, and dose limitation. The primary aim of radiation protection is to provide an appropriate standard of protection for man and the environment without limiting the beneficial practice giving rises to radiation exposure. In Malaysia, the use of ionizing radiation is controlled by the Atomic Energy Licensing Act 1984, which is the Act 304 that includes both the use of medical and non-medical application. The authority for the use of medical application is Director General of Health, the Ministry of Health. And there are a few regulations under the Act 304 includes the radiation protection, which is the BSRP Regulation 2010 and Atomic Energy Licensing Radioactive Waste Management Regulation 2011. The Act 304 and its subsidiary regulations explains the concept and principle of radiation protection to patients, radiation workers as well as public members in details. Before that, let's get back to the radiation definition. Radiation is energy that comes from a source and travels through space may be able to penetrate various materials. It can be classified into two categories, which is the non-ionizing radiation and ionizing radiation. Non-ionizing radiation is the type of low-energy radiation that does not have enough energy to remove an electron from an atom or molecule. Non-ionizing radiation includes visible, infrared, and ultraviolet light, microwaves, radio, and radio frequency energy from cell phones. Most types of non-ionizing radiation have not been found to cause cancer, while ionizing radiation is a type of high-energy radiation that has enough energy to remove an electron from an atom or molecule, causing it to become ionized. Ionizing radiation can cause chemical changes in cells and damage the DNA. This may increase the risk of developing certain health conditions such as cancer. And ionizing radiation can come from natural sources such as radon and cosmic rays. And it may also come from medical imaging equipment such as X-ray, CT scan or PET scan machines. The nuclear power plants, accidents and atomic weapons also release high levels of ionic radiation. Being exposed to very high doses of ionizing radiation can cause immediate damage to a person's body, and it including severe skin or tissue damage, acute radiation sickness, and even death. So, the protection of people and the environment from harmful effect of ionizing radiation and for the safety of radiation resources, which apply to three categories of exposure, which are occupational, medical, and public exposure. Occupational exposure is when workers exposed in the course of their work, and medical exposure is when patients undergoing exposure for medical diagnosis or treatment. A basic principle of radiation protection in patients is the need to maintain exposure to ionizing radiation at a level of as low as reasonable achievable, which is the ALARA. With economic and social factors are taken into consideration. The implementation of ALARA principle is achieved by application of the basic principle of radiation protection. The radiologist and radiographer have to educate patient with sufficient information regarding the radiological examination and to assure that patient that benefit is outweigh the risk. One of the best accepted method of the providing the information is through comparison of relative radiation risks. So, when working with radioactive materials, remember to minimize exposure at all possible times by limiting times, increasing distance, and shielding. Minimize the time will result to minimize the dose. So, pre-plan the experiment or procedure to minimize exposure time. So, it means that less time spent near sources get less radiation received. Other than that, if you doubling distance from the source can reduce exposure to 25% and use forceps or tongs to increase distance from the radiation. The position shielding between yourself and the sources of radiation at all permissible time is required, and select appropriate shielding material during the planning stages so it will not occur other implications. As may be observed in the graphic, we can see that less penetrating types of radiation emitted in a nuclear event are radiation particles, which is rather than rays, and alpha radiation particles, which are relatively slow, can be blocked by cloth. Beta radiation, which are smaller and faster, can be blocked by synthetic fabric, which is cover the whole body. Our body, and of course if alpha and beta radiation particles are ingested, they can cause damage, and thus our airways, which is the nose and mouth, should be protected even with a dust mask, and more effectively with a common respirator. Eyes and hands too should be protected. Wear goggles and gloves. Yet the cause of acute radiation sickness is gamma radiation, which is the penetrating type of radiation emitted during a nuclear event. So, the radiographer are responsible to ensure that patients are worn proper protective devices to minimize patient exposure while producing a satisfactory diagnostic image. Personal protective devices includes gonad shielding, lid apron, thyroid shielding, and goggles. Some organs are sensitive to the radiation, such as kidneys, female breast, and the lens of the eye. Lid aprons are also used to protect patients from unnecessary X-ray radiation exposure from the radiological procedures. And lid apron is designed to shield the body from harmful radiation. It is important to remember that the use of lid apron only effective it is where properly matched with the appropriate radiation energy. Also, the radiographer has to ensure that the size of the X-ray beam should always be restricted to the area of clinical interest and should never exceed the size of the image receptor. Proper collimation not only reduces patient dose but also improve the overall image quality because less scattered radiation is created with smaller field size. In conclusion, it is very important to maintain a safe procedures based on the regulation that have been introduced. Handling radioactive materials could make someone's in danger and threaten life. During a radiological or nuclear emergency, radioactive materials may be released into the air and then breathed into the lungs or may get into our body through open wounds. Radioactive materials can also contaminate the local food supply and get into the body through eating or drinking. This is called internal contamination. The sooner internal contamination is removed from the body, the fewer and less severe the health effect will be. A small amount of internal contamination may not need treatment. And that's all from me. Assalamualaikum warahmatullahi wabarakatuh. Thank you and goodbye.